Hi, I'm Dr. Michelle Alencar, co-founder of Inhealth. Did you know the United States spends more on employee health care than any other country in the world, and yet outcomes are getting worse? Well, chronic disease is now more prevalent, more expensive, and more difficult to manage than ever. It's not because we lack solutions, it's because people don't use them. Healthcare doesn't have a treatment problem, it has an actual behavior problem, and no one has solved it at scale until now. We're Inhealth, and it's a clinically validated digital therapeutic platform that drives sustained behavior change across chronic disease, obesity, cardiometabolic health, sleep apnea, tobacco use. It goes on from there. Instead of fragmented point solutions, which is what's in the employer market right now, we deliver one continuous experience that helps keep people engaged over time and produces measurable outcomes. We've spent the last decade building and validating this model across employers, health plans, and provider networks. We service today 135 employer groups, 2 million covered lives, and have achieved over 90% program completion compared to just 30% in the industry average. And right now, we're actually at an inflection point. We have a partnership with Amwell and also Elevance Health. Then we're transitioning for operational ownership and guaranteed distribution for another 3 years. So what does that do? It unlocks direct access to 290 employer groups and up to 19 million lives starting this year, July 1. This is not a pilot. It's an immediate embedded distribution that we will now take ownership of and be able to unlock. And how we're going to scale this is our fully integrated AI behavior infrastructure that we've built based on our decade of evidence. CoachLink is that AI-powered behavioral infrastructure that enables this continuous engagement, intelligent routing, and personalized support at a full population scale without requiring new apps or workflow changes. So this actually will allow us to move from a service-based model to a scalable platform with a clear path to a 10 million plus ARR and over 40 million in combined potential revenue in only 3 years. So we're raising $1 million right now to scale our platform that supports a July 1 deployment. We need this. We know that we're going to make a huge impact and will accelerate enterprise growth ahead of a planned additional round that we have later on. This is actually a rare moment, and it's a decade of clinical validation that meets immediate large-scale distribution. So if you're interested in helping us scale our behavioral infrastructure that is embedded behind multiple chronic disease states like cardiometabolic disease, we'd love to connect. Thank you so much.